bone comes in, and we really, probably the safer place for us to be is down deep on the bone, so that hopefully we can avoid the vessel. So I spend a good amount of time doing Mohs. I always kind of pause when I see something of interest, and you can see the course of the vessel and therefore the course of the nerve as well in this area, sort of midway between the lateral brow and the hairline. And I think if we use our anatomic landmarks and think about them, then probably the safer place to inject would be here or along the hairline, and then just go deep into that fossa. So knowledge of anatomy of the temple is very key to success. I like to use deep injection points. I think we have pre-packaged needles that come with our filler that in most cases are ½ inch. And I actually take that blister pack, open it up, and replace that needle with something else. In the temple, I usually use a 27 gauge, but I use an 1.25 inches, so I can actually go down very, very deep. And it may be safest to stay in one place. You know, we've heard people talk about aspiration. I'm not a true believer that you can aspirate the gel that well, but I think if you stay in one place, you have a better chance of hopefully getting a lift and avoiding trouble. So some folks have actually, just go back to that, have described diluting down the filler in the temple area. Val Ambrose did a project in aesthetic surgery about that by taking 2 cc's of Restylane and making it 6 cc's with the addition of lidocaine and saline. Doesn't make a lot of sense to me. I use full strength filler in these areas, and this is just an example. This is how I approach the temple. Medially first, and lift up along the temporal fusion line, very deep, using a 27 gauge 1.25 inch, and then going along the hairline, very deep, 27 gauge 1.25 inch down bone, and lift up in the area. So I'm out of time, unfortunately. Our next speaker is jack of all trades from a medical legal perspective to lasers, to Mohs, as well as injectables. He's going to be discussing some of the new fillers